Okay, my recommendations, I think the knee-jerk reaction is to say I've got a dog with has liver disease, we need to put him on a low protein diet. Thinking we used to think that the liver has to metabolize all these proteins, and so you don't want the liver to work as hard. And what we now know is that probably animals with liver disease, as compared to a normal animal, they may actually have higher protein requirements than a normal patient. And so, as far as the protein, I only restrict protein if I have an animal that has protein intolerance. So that would be the animal that might have hepatic encephalopathy with advanced liver disease, or maybe your portal systemic shunt patients. Otherwise, I generally recommend a good quality diet. A lot of people like to use the liver diets, and the liver diets are, there's some advantages to those. They are moderate protein content, and they're very balanced. Uh, in a young growing dog, they may not quite have enough protein. And so sometimes I'll have to supplement additional protein, and I would recommend people talking to a veterinary nutritionist to help them in that regard. One of the advantages of some of those liver diets, which I use quite frequently, is that they are very low in copper. And we are seeing more and more patients now with liver disease associated with increased copper. And most all the commercial diets probably have too much copper in it for those patients. And so that would be one of the big reasons for using a liver type diet. The liver diets also have a lot of antioxidants, which there are some benefits in that regard as well.
I think probably the most important advance, or at least sea change that we're seeing, is that we're moving away from a sort of a knee-jerk reflex where if we diagnose liver disease, people immediately think that we need to restrict dietary protein. And I think we're understanding that protein requirements may actually be increased in a number of patients, even patients with very severe liver disease. And if we inappropriately restrict dietary protein in those patients, then we can make matters worse. So the traditional diets that have been prescribed for liver patients, and many people will use so-called renal diets or kidney diets that have a low protein intake, they may not contain. In fact, I would go as far as to say they often contain too little protein for the majority of our patients. And I will only recommend feeding that low when we've seen evidence of intolerance to a higher amount of dietary protein. So at the moment, we don't have at our disposal any bedside clinical test that enables me to look at a patient and say, what is this patient's protein requirements? On that basis, we have to guess. But we do know that protein requirements tend to increase above what a healthy animal, their minimum that they require. Whereas the diets that are formulated for renal disease and the diets that are most highly restricted in protein, those manufacturers are pushing the protein content down as low as they can based on what a normal, healthy animal will tolerate. And so that may be, in some patients, significantly too little, especially if their intake is not meeting their energy requirements. So I think the greatest change is that we're focusing less on the exact protein content and more on the type of protein, the source of protein, and trying to avoid some of the what we call non-protein nitrogen-containing compounds, nucleic acids, and some of the poorly digestible proteins in things like heme. Those are the things that tend to create or are more deleterious on the brain function, and there are things that we want to avoid. So I'm much more interested in feeding a highly digestible source of protein that comes from dairy, egg, or vegetable sources than I am about the specific percentage that I want to get it below. And so some of the traditional renal diets may not be ideal as far as their source of dietary protein. So we will, if we're formulating a diet through our service, we'll focus very much on digestibility and protein source, and we'll push that protein. How much will this patient tolerate? And if they have no signs of hepatic insufficiency, then we will feed what would generally be regarded as a moderate amount of protein based on the range of commercial diets available. And I think that the type of protein rather than the narrow protein restriction is probably the most important thing. So that has been a bit of a sea change. So for many of our patients with liver disease, we may make no specific dietary change at all, depending on what they are eating. And many of the traditionally highly digestible diets that are formulated for animals with gastrointestinal disease are perfectly adequate for many of these patients.
Yeah, certainly I think there have been a number of developments in the nutritional support for cats with liver disease over my time as a clinician. And I guess the major developments, I think, have been in the availability of commercial diets for cats with liver disease, as well as the palatability of those commercial diets, and also in the development of nutraceuticals for both cats and dogs with liver disease. With respect to what recommendations I make for nutritional support of cats with liver disease, it does depend a little bit on the specific type of liver disease which they suffer, because not all liver disease will require specific nutritional management. If the patient is suffering from clinical signs of hepatic encephalopathy or hepatic failure, for example, a cat with a portosystemic shunt, then the dietary recommendations are for a low-protein diet combined with other medications such as lactulose or antimicrobial therapy such as amoxicillin to reduce the bacterial production of ammonia and urea. A lot of cats find liver diets quite unpalatable because they don't have a lot of protein in it, and oftentimes if they don't like the specific liver diets, I'll use a renal-based diet because it's also a low-protein diet. For patients with hepatic lipidosis, it's my personal feeling that providing calories is the most important thing. So oftentimes if you're using a feeding tube in those particular patients, then you'll be using a diet such as Hill's AD or Eukanuba Recovery or a similar product. So it's a really high energy diet, but really you just want to get the calories in to reverse that negative metabolic sort of process. So in theory, some diets for cats with liver disease would have some benefit, but as I said, it's my opinion that just getting the calories into the cat is most important. But if the patient is clinically well, then and they're not got hepatic lipidosis and they don't have hepatic encephalopathy or hepatic failure, then I don't necessarily make any specific dietary recommendations. Or alternatively, the diet might be recommended based on what their intercurrent illness is, for example, inflammatory bowel disease or renal disease.
I think it really depends on what specific liver disease the cat's suffering from, what the cat's clinical signs are, whether they've got any comorbidities. So, for example, with inflammatory liver diseases in cats, they frequently occur together with pancreatitis and or inflammatory bowel disease, and that might really change my dietary recommendations. I guess the main type of liver disease where I'd recommend a very specific liver prescription diet would be cats with portosystemic shunts or with hepatic lipidosis, where they may have hepatic encephalopathy. And in those cases, a moderate protein restricted diet is important. But with the more common inflammatory liver diseases in cats, I don't tend to recommend a specific diet. And in fact, with those diseases, it's usually important that protein isn't restricted. And so a specific liver prescription diet might actually be contraindicated in a lot of those cases. Often those cats might be inappetent, and so I tend to offer them really whatever complete commercial cat food the cat's going to be more inclined to eat. Some cats that might have concurrent inflammatory bowel disease and or pancreatitis, then a highly digestible, moderately fat-restricted diet might be indicated for their other disease, and that will also be fine for their liver disease too.
Other things as far as nutritional support, well, when we talk about cats in particular, some of the things we see are hepatic lipidosis that can occur quite rapidly in cats if they're not getting adequate calories. And, I'm really concerned about cats that haven't eaten for several days, or the lipidosis cats. And those patients, what we often will do nutrition-wise, if they're not eating, is place a feeding tube so we can get nutrition in that way. And with cats, I'm not so much concerned about protein because cats have a tremendous protein requirement. And so I use some of the recovery formulas or commercial formulas that I can put through a feeding tube.